Mental health to me is the social, emotional, and psychological well-being of a person. And the reason why it matters is because it does affect us as human beings. For a really long time, people have ignored the importance of mental health. We've not viewed mental health as something necessary to talk about. And we fail to realize how much mental health impacts us in our daily lives.
I had the coronavirus, and ever since my life has been affected. I'm very conscious with the way that I interact and socialize with people. I always keep a social distance. I wear a mask every time I'm in public, and I wash my hands regularly.
There's a lot that I can't do it now because of the coronavirus. I'm one of the people who has suffered from coronavirus. At that time it was really hard, and nobody was coming to visit you. And at the same time, I'm one of the people who lost loved ones.
Coronavirus has affected my life, economical, physical, and mentally. Physically, because I've been working in the office, and it has been difficult for me in terms of maybe having internet connectivity. And then also the family has always been in the house. My immediate relatives have been in the house, and it has been difficult for me economically in terms of feeding them.
COVID-19 has been an eye-opener for my life. I've gained a lot of experience. I've gained a lot of strength and bodiness, and not the way I was. Yeah, of course, I went through a lot as an individual the time we had this pandemic. You know, in the first place, when you are going for a shift during the COVID-19, it was as if you are going to die. You are actually going to the front line battlefield where it was suicidal sort of. So as a result, it was really frightening.
COVID-19 pandemic began, it has been very unsettling. To me personally, the isolation, the staying at home was very depressing. And in my community, I saw the youth get laid off from work. I saw students not go to school anymore. And you know, we all had to cope with all these changes that were also sudden and very unexpected.
Corona wakati imeingia imepunguza kwa kazi. Hapo tunakuwa na hitaji ya kwamba Mungu atusaidie corona wakati takapoisha, mara moja turudilie kazi zetu zenye tulikuwa tunafanya mbele, na pali tusaidie kusudi jamaa zipate tena usalama yenye walikuwa wamekosa, na watoto tena wapate kwa amani.
During the COVID-19 situation, I personally feel worried, scared, live under fear. But for how long shall I continue living in that situation?
Dealing with the virus can be stressful and scary. To cope, I've always remained calm. I've encouraged talking about the virus just to assure my family that everything is going to be fine. I exercise regularly. I read to keep an active mind. I eat well and I sleep well.
Being in lockdown gave me an opportunity to consider and commit to my meaningful values and goals. This shifted my attention from my situation to something else more meaningful. And this also served as a coping mechanism for dealing with the stress and change I was experiencing. Being able to share my feelings and frustrations with my close friends and family made me feel supported and so much love.
Some of the people I go to when I am feeling frustrated or overwhelmed or just tired, whatever feelings that I have, are my best friends, my closest friends. I also go to my siblings to just tell them, like, yo, ABCD happened, and I get it out of my chest. Like, I really believe in getting it out of your chest. Like, I am, I would ask the person, like, are you in a position to listen to what I'm going through and share what I'm going through? Because I believe it's really important to have somebody, like a support system that helps you cope through difficult times. Because sadly, this life is just not, all like sunshine and rainbows and all that. So you have to have a strong support system. And my strong support system includes like my family and my friends.
The biggest thing that was a plus that I saw is that among the refugee community, the youth were able to channel all this negative energy into good use. I saw youth groups come together to raise money to provide personal protective equipment for the vulnerable in the society. We were also able to provide relief supplies such as food to people who were in need, who had been severely affected by this pandemic.
I also developed some other strategies in which I can cope up with the situation. For instance, mentally, I normally keep in touch with my loved ones. I have to talk to friends. But the good thing that I learned in this situation is the system. I realize it's a good practice to keep on checking on someone and someone keep checking on you.
There are some things which I never used to do before. I never used to do meditations. So now I do a lot of meditation so that I can calm down in my mind. I read Quran usually. I pray a lot. I do some physical exercises in my workplace and also at home whenever it's possible so that I can cope with this high stressing time.
Mentally, I do things like dancing to music, making calls to friends and relatives, and also communicating with friends and relatives through different platforms including WhatsApp, Facebook, and Instagram.
As soon as the coronavirus pandemic is over, I would like to immediately travel to places, and especially travel. The first place I'd like to visit is Nairobi to see my siblings who I have not seen for the last 5 or 6 months since coronavirus onset.
After this COVID-19, I just want to travel safely. After COVID, I'm looking forward to freely visit my friends.
When the coronavirus is over, I'll have to visit my family in Kenya so that I have to stay with them for some time.
Moving on, once everything is done, I just want to go on a vacation with my family, just to relax and be free.
Today, on World Mental Health Day, I would like to say, you matter. Your mental health matters. It is okay not to be okay, but it is definitely not okay for you to stay silent about it. It is okay for you to seek help. It is okay for you to go for therapy. It is okay for you to take medication to help you cope with your mental illness. It's okay for you to have a mental illness. That does not make you any less human. Your mental health matters every single day. So take care of yourself, love yourself, show yourself so much love and so much care. You matter.
In 10 years from now, many youths may become broken adults. We need to be cared for. We need to be protected. We do not deserve to feel hopeless and worthless. Use your voice to call on governments around the world to invest in, to empower and educate on mental health for all. You are born to be incredible. Believe it and never look back.